How many PRP treatments are needed to treat hair loss?
Whenever I'm asked about PRP for hair loss, I can't help but remember how not so long ago in 2011 when I began developing what is now Tricostem hair regeneration, how negative and disparaging so many of my so-called colleagues were about PRP and ACell. How far we've come. Before discussing numbers of treatments, we should define some basic terms and my work in developing Tricostem hair regeneration. Platelet-rich plasma, or PRP, is a concentration of the cells and other factors in your blood which are activated when you have an injury like a cut. Prior to my work on hair loss, I was amongst the first group of doctors in the cosmetic medical field to use PRP. I used PRP for skin rejuvenation, for fine lines, wrinkles, and discolorations that occur from sun damage. I also used PRP for acne scars and under-eye dark circles, as well as in combination with surgical and laser procedures. ACell is a company that produces a wound healing material called extracellular matrix. This material has been FDA approved for wound healing since 2008 and essentially recruits your adult stem cells to expedite wound healing. A few years ago, I was surprised to see how many doctors and medical retailers had a change of heart and started offering PRP for hair loss. A typical patient for these generic PRP or PRP with ACell will need to have scalp injections every month to every 3 months. Unfortunately, this approach does not appear to be delivering consistent results to the point we're seeing a lot of patients who tried PRP for hair loss before learning about Tricostem hair regeneration. Tricostem hair regeneration originated from when I was using extracellular matrix with PRP for hair transplant patients to improve graft survival and wound healing. We observed that a year later, native hair that wasn't transplanted had increased in number and became thicker. This inspired me to develop methods to combine and deliver extracellular matrix and PRP to help men and women with hair loss. Currently, several of the treatment plans we use involves 1 to 2 treatments 18 months apart with sustained benefits seen for 3 to 5 years and longer. A few years ago, I was surprised to see how many doctors and medical retailers were now offering their version of ACell PRP. Over many decades, hundreds of millions of dollars have been spent on research to cure hair loss. Unfortunately, at this time, there is no cure for genetic pattern hair loss or androgenetic alopecia. We can, however, manage hair loss and optimize your scalp coverage within the limits of the extent of your hair loss and the longevity of your hair follicles.